following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, medications. Two experts are here to answer your questions. Now here's your host, Dr. Raleigh Sullivan.
Good evening, and welcome to our 600th episode of Doctors on Call. When we started this program 18 years ago, our goal was to help West Virginians get healthy and stay healthy. And you, the audience, are a big part of our success this show. You know, WVU health experts are here nearly every week to answer your questions, and we appreciate your support. Tonight we're talking about medications. It seems you can't watch television or read a magazine these days without seeing an ad for a prescription drug. It can be confusing to determine which drug is right for your condition. That's why medication communications with your doctor and pharmacist are crucial. What are the side effects? What are the possible interactions of the drugs you're taking? Are generic drugs as good as brand names? Should you be concerned with over-the-counter medications, vitamins, and supplements? Well, we'll get the answers to those questions tonight and more from our two guests, Dr. Charles Ponte, a pharmacist with the WVU School of Pharmacy and in the Family Medicine Department of WVU, who specializes in pain and diabetes management, and Dr. Betsy Ellswick, a clinical pharmacist in the WVU School of Pharmacy, whose special interests include providing care in rural areas. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. So Betsy, let's start with you. There's been a lot of news this week about the recall of some children's over-the-counter medications.
Yeah, it's been, I think, quite a scary and confusing week for parents. We've received a lot of calls at the School of Pharmacy and also at community pharmacies statewide about the recent recall. The recall affects products made by McNeil Pharmaceuticals. Those include various formulations of children's Tylenol, Zyrtec, Motrin, and then also a couple of Benadryl products.
Are these all over-the-counter products so far?
They are all over-the-counter products, so you may have them very well in your prescription or in your medicine cabinet and have forgotten they're there, but even if you bought them several months ago, you really should check and see what products are in there.
Okay, well, so Charlie, what should parents do if their kids get sick?
Well, I think we have to answer the question before that. If they have that product that actually has been recalled and they give it to the child, what may happen? And I think we have to kind of, tell the public and tell the viewers tonight that if the child does take one of those products, that nothing probably will happen, because we have had really no reports of any adverse effects from a child taking one of the recalled products. Now, if they don't have none, not to this point.
Okay.
And not to say that it can't be reported in the future, but as of this moment in time, I'm not aware of any bad side effects or outcomes from a child receiving one of the recalled products. Now, if they don't have a recalled product in their household and they're concerned because of the recall, then what they need to do is go to their local pharmacy, their community pharmacist, and actually purchase a generic version of the brand name product that had been recalled, which is certainly just as good, just as effective. The doses would be exactly the same. And that would be at least one approach, I think, that one can take with a sick child, where you want to give one of these products that in fact had been recalled, but is to get a generic product.
Well, let's talk again, just make sure that we get that out to the audience. What are the products that were recalled?
Well, the products that are recalled, there are various formulations, again, of children's brand name Tylenol, Motrin, Zyrtec, and again, a couple formulations of Benadryl, and they're all really pretty much liquid formulations. So I brought an example here of a children's Motrin product because it gets a little confusing to parents as to what products have been recalled. The best way to find out whether your product has been recalled is to actually, if you have internet, go online. You can go to the United States Food and Drug Administration, that's the FDA, and the website is www.fda.gov. Again, that's www.fda.gov. They list out the NDC numbers for those products. An NDC is a National Drug Code. It's a 10-digit number, and it's found on the box or on the bottle, usually above the name of the product, but not always, and it's very small. Now, the NDC number is not to be confused with the barcode, which is at the bottom, okay, the thing that you would scan when you go to the pharmacy or grocery store. But it's the NDC number.
On the very top of the box.
Well, some of them are at the very top, but not all of them. So, but it will say
But it says NDC
yes,
before this 10-digit
exactly.
number. Okay, great.
So go to the website or go to your pharmacy and double check.
Okay, well, we have our first caller. This is Roberta from Marion County. Roberta, welcome to our 600th show. You have a question for us?
Yes, I do. I'm concerned and wonder how much I should be concerned about the study on Fosamax and its generics, that after so long the effect is nullified and even reverses, and whether I should stop taking this medicine.
Yeah. It's Roberta, right?
That's correct.
Yeah, Roberta, you know, it's sort of interesting. I know a little bit, I think, about what you're really saying, and there has been some reports in the literature about people that have been on it for a long period of time that it may actually reverse some of the beneficial effects that you see from that in terms of making your bones stronger. You know, I have not heard of whether or not that's related to the generic version of that kind of a product, and so I don't really have a good answer, except that when you have a concern about a prescription medicine like that, which is being used to maintain your bone strength, that you probably discuss that with your primary care physician to see if maybe, one, that it's working for you, and two, if you could be perhaps even switched to another product that's similar to it or has the same kind of an effect on making the bone stronger. So
that seems like reasonable advice. We have another caller. This is Wanda from Kanawha County. Welcome to the show, Wanda. You have a question for us?
Yes, I do. Thank you very much. I take anti-inflammatories, and I have a lot of inflammation throughout my body from arthritis and whatever. I have now been taking Voltaren. It's an old medicine. And with each one I take, I have weight gain and water retention. And all of my doctors I've been to say, well, I've never heard of that. We don't think that's caused from the medicine. I can stop taking the medicine, and I can lose 9 pounds like overnight. I just wanted the explanation, maybe.
How old are you, Wanda?
59.
59.
Did the weight gain start when you started taking the medication, Wanda?
Yes, they did. It did.
Have you done a trial yet with has your doctor asked you to stop taking it to see if the weight gain goes away?
That's when I lost the 9 pounds overnight.
Okay.
And she said, get off the medicine.
I missed that.
Yeah, Wanda, one thing that could be happening is the drug sometimes can affect the way your kidneys actually sort of hold on to excess water in your body and make you retain extra fluid. But often that's in people that have other underlying problems, like when their heart doesn't pump like it should, if they have something called congestive heart failure. So those are things that, because you've gained so much weight so rapidly, since you've started the medication, I think it's worth that you discuss that and probably see your physician about that issue. It
sounds like that's something she should do sooner than later, that she's already done the experiment.
Indeed. And there may be newer, more effective medications.
Right.
Voltaren, is a great drug, but it is an older agent, and there could be newer, more effective agents that have less side effects.
We have our next caller. This is Larry from Roane County. Larry, welcome to our 600th show. You have a question for our panel?
Yes, I take Coumadin. And I've been told Coumadin, and I've been told that leafy green vegetables will affect that. And also, I want to know, I have allergies, and can I take over-the-counter allergy medicine with the Coumadin and not affect it?
Yeah.
Coumadin is a tricky, tricky drug because you have to watch for any kinds of foods or other agents that have vitamin K, because it's one of those drugs that you have to keep at just the right level in your body, and things like he mentioned, cabbage, especially greens, might have lots of vitamin K in it. There's a whole list. You can get again, if you have internet, that's a great source, but talking to your physician and pharmacist. But very, very tricky. And over-the-counter agents, we were talking earlier, I think a little bit about this too, can interact with agents such as Coumadin, depending on which one you're taking, if it causes any blood thinning at all. So
yeah, Larry, I want to add just one thing about the diet issue, because the way the medicine works is it really works in your liver to prevent the manufacture of clotting factors, and those are dependent on vitamin K. So when you eat foods that have a lot of vitamin K in it, it sort of reverses the effect of the medicine, which is to really chemically take longer for your blood to clot. So when you take a lot of, green leafy vegetables or other foods that really can affect, they really provide the vitamin K that is trying to be inhibited by the Coumadin, and so you kind of really reverse the beneficial effects.
What about the second part of his question, taking allergy medicines with it?
Well, as was mentioned, Coumadin interacts with a laundry list of medications that's probably as long as I am tall, literally. And so all of those interactions are not probably well known by physicians, pharmacists, but we certainly have the tools to be able to look at the specific product that you take or medicine and then kind of run it against the Coumadin and see if there is an interaction that takes place and if it's significant or not, where it could mean that one should not take that other medication like an allergy medicine, or you actually may have to change the dose of the Coumadin or the warfarin.
That's what I was wondering. Sure.
And that could be
too much of an effect.
If he's taking Coumadin, other agents for blood pressure. That's what I was thinking too. Is really some of the things for allergies may not interact with Coumadin, but if he's on anything for blood pressure, then you kind of run into some problems with some of your combination
Well, this is something you need to talk over with both your doctor and your pharmacist.
You really do.
Absolutely.
Listen, we have another call. This is Debbie from Marshall County. Debbie, welcome to the show. You have a question for us?
Yes. I've been on Ativan for about 3 years, I guess for depression, anxiety, but I want to know what the side effects are from it. I have lost a lot of weight, stay very nervous, agitated, but cannot do antidepressants. I've tried them and they make me worse.
How much Ativan are you on?
4 pills a day, 1 milligram.
4 milligrams a day.
Yeah.
News.
Who wants to take that?
Well, the major side effect with Ativan for most people is it makes them kind of sleepy, makes them drowsy, they don't have much energy and pep, but you say that you're you're kind of jittery all the time and somewhat nervous and anxious.
Yeah.
And that's usually not a typical side effect for Ativan.
What you worry about maybe is that she's become tolerant.
Yeah, exactly. And that also is going to require that she visit her primary care physician and maybe discuss that issue, or psychiatrist certainly, and see if it's going to require a medications change or a dosage change or maybe some other technique.
This is one of those things that I end up dealing with quite a bit, and 4 milligrams of Ativan and she's still anxious is actually kind of worrisome, because that's a fairly hefty dose of Ativan and most people would be sleepy on that. So I would suggest she get together with her doc.
And she said she can't take antidepressants or other agents, but again, there may be newer agents out there that have less side effects that she might do okay on, that as a class there are so many different classes of antidepressants and anti-anxiety agents
That's a really good point. Yeah, there are a lot of different antidepressants. We have another caller. This is Elle from Marion County. Elle, welcome to Doctors on Call on our 600th show. You have a question for us?
Well, thank you very much. Yes, I do. My concern is with the recalled Tylenol and Tylenol products. I have been giving my children both of these medications. I've got a 2.5-year-old and an infant for the last month. And then, of course, I usually buy the name brand products anyway. And what would constitute an adverse reaction? I'm not sure exactly what I should be looking for.
Well, we don't really...
I've given them both Benadryl, I've given them both the infant Tylenol and the children's Tylenol, and I'm just kind of concerned about what I should be looking out for.
That's a really good question.
It's a great question and it's actually one of those questions that's such a good question. I don't think we have an answer for exactly because there haven't been any reported yet. But what I would say to this mother and any parent or person that's been giving their child, I'm guessing these medications, I had a family member call me and said that she had given her daughter one of these medications, and we talked about it, and I said, well, is she doing okay? Well, yeah. Did she get better? Did her fever resolve after you gave her the Tylenol? Well, yes. Well, then it's okay. It's okay. Just throw it away. So I wouldn't actually keep giving it to look for any side effects. I would just throw it away. And my statement to the parent would be, did the child get better? Is there anything unusual? Side effects could be anything from rash to upset stomach to breathing problems. There's a whole host of different things that they could have.
Throwing it away.
Well, throwing it away is obviously, because it was a recalled product, one should throw it away. And that gets into the whole issue of how do you throw away a medication.
Right.
Absolutely.
Because there's been a lot of news in a lot of press about drugs sort of creeping into our water supply because everybody is on some kind of medication. And so through our normal elimination, it winds up in our water supply in small amounts, nonetheless, but nonetheless there.
It's there.
So if you have a product like a liquid, and let's say it's one of these Tylenol products, and it's a recalled product, what you can simply do is mix it. You can literally take it out of the container, mix it with some cat litter, which absorbs it, or even old coffee grounds. It sort of absorbs it, makes it really very distasteful for pets and for small children, to kind of rummage in coffee grounds or something like kitty litter, unless you're a kitty. And then you simply take that material and you can put it in a plastic bag, or you can put it in a can, or you can somehow tie it off, and then you throw it in the garbage. Okay. And that's usually sufficient for most things.
I'm glad we talked about that, because I know this is getting to be a big issue. How do you get rid of medications? Right. We have another caller. This is Barbara from Raleigh County. Barbara, welcome to the show. You have a question for us?
Yes, I do. I have reflux disease, and I had been taking Prevacid, 30 milligrams, and it was changed to an over-the-counter medication, and it changed to 15 milligrams that you take once a day. I'm having more stomach problems, and the doctor had suggested that I take Capodex, which is also 15 milligrams. Would it be possible to alleviate some of my evening and afternoon pain if I could take Capodex or Prevacid over the counter twice a day?
Well, I think there's another issue here, and that's why you're having more pain, because maybe that there's something else going on, and I'm going to make an assumption here that maybe you have reflux, disease, where the stomach acid sort of comes up in your swallowing tube. And I think in light of that, one piece of advice would be to certainly have that checked out and see if there's something else going on, because it doesn't necessarily mean that it's reflux. Now, I do know that some patients who are on prescription sort of antacids, these drugs like Prilosec and Zantac and what have you, that people will have what's called breakthrough symptoms, and they actually start having more acid secretion, and they start to have symptoms. And we sometimes will actually tell that person to take an over-the-counter preparation, or even a liquid antacid is very helpful for sometimes breakthrough pain or symptoms like that. But if it's a change in how you are feeling and the pain is worse and there's something different about it, I think it's really important that she probably see her primary care physician and be checked out.
The Prevacid, what she mentioned too, is there's a different kind of version, a generic version that she mentioned that she may be taking now, which is also available, very similar to the Prevacid. The Prevacid, when it moved over the counter, stayed really exactly the same as it was on prescription. So the fact that her symptoms got worse when she switched to the over-the-counter agent, like Charlie said, she really needs to go back to her physician and get that checked.
I think that's good advice. We have another caller. This is Sue from Ohio County. Sue, welcome to the 600th show. You have a question for us?
Thank you. Yes, I am taking Chantix.
Chantix, yeah.
To quit smoking. And the problem is that I'm still smoking. It's starting to work. It's not real consistent. And I know it says that you shouldn't smoke past 8 days, but it's very close to 8 days. It's been about a week. So what am I normal? What am I looking at? I'm also very, very irritated. And I know that's one of the side effects.
Let me
patience whatsoever.
Let me jump in on that one, because I've had a lot of experience with smoking cessation, and say that Chantix is an excellent medication to help people quit smoking. It works in the same place in the brain that nicotine does. There's a couple of things that you can do. You've been on it a week and you're still smoking. My guess is you've probably cut way down on your cigarettes, and I would continue to stay on the dose tablet twice a day for at least another week or two, because you may find out that it'll start to work and your interest in cigarettes will diminish. The other thing you can do is you can get on their, if you sign up for Chantix, you can get on the free counseling program that comes with it. It's called Get Quit. It doesn't cost you anything once you have the prescription, and they could be extremely helpful to you in dealing with those times a day in which you're really craving cigarettes. If after a month or so you're still smoking, you're taking the medicine, and you've got a counselor, and you're seeing your counselor, then you might want to go back to your doctor and talk about readjusting your dose.
You brought up a really interesting point too there with triggers. We see a lot of patients in our pharmacy that come to us and they get really upset when some of these drugs, very good drugs like Chantix, don't immediately start working. When we start talking to them a little bit about identifying triggers, we had a patient one time that just by taking a different route to work every day, by bypassing this one stop sign, we eliminated a cigarette right there. So there are a lot of behavioral aspects that, like you mentioned with the Chantix, with the programs that a lot of these companies offer that can help. Keep it up, though. Good luck
Absolutely,
with her.
She needs to keep it up. Yeah. It's one of the, maybe the most difficult addiction. We have another caller. This is Mary from Raleigh County. Mary, welcome to the show. You have a question for us?
Yes, I do. I'm an 83-year-old.
83.
Very active.
Good.
And 4 years ago, I had stents inserted, and I went to my heart doctor, and he said, I'm fine. I don't need to see you for another year. Okay. I'm on Plavix, 75 milligrams.
Plavix.
Okay.
Toprol is 25 milligrams. And Prevacid 40 milligrams, 1 day each. And also, I am taking Ativan 2 milligrams, 1 at night only.
Okay.
And the doctor today put me on, 5 weeks ago, put me on Fosamax. And I take it once a week, and it's been 5 weeks ago. And I have lost 14 pounds. And I just don't, I don't feel like I should take it, and I don't want to argue with people. So could this be causing my weight loss?
Mary, I guess I'm not sure what you're concerned about your recent weight loss.
Yeah, that's what she's worried about. She's lost 14 pounds.
Well, it's probably not related to any of your medicine that you're taking, but if it's the weight loss has occurred over a short period of time without you really wanting to lose weight, then I think that's reason enough to probably go see your primary care physician, because weight loss that you really have no intention of, when you have no intention of losing weight, could be an issue. It could be a problem that needs to be looked at and maybe fixed. So my advice would be leave the medicine alone and maybe go see your primary care physician, because that weight loss is probably not related to the medicine.
The other question I would have for her a little bit, as you said, 14 pounds is a good bit really quickly, but Fosamax, does have specific directions where, you can't lay down or eat anything or drink anything after you take it. And for a lot of people, not a lot of people, but some people may, develop, ulcers or something from taking Fosamax. I don't know if it's causing her significant nausea, but go see your doctor.
Right.
Absolutely.
Let me try to get one more caller in here. This is Pearl from Fayette County, Pennsylvania. Pearl, welcome to the show. You have a question for us?
Yes, I do, doctors. I'm 58 years old, and I'm a diabetic, and I'm diabetic number 2. And my question is, I take Diabeta, which is a pill, 2.5 milligrams. And recently I changed pharmacies. And the pharmacy could not get the 2.5 milligrams, so now they're giving me 5 milligrams. Which I can use also, but I cut it in half. But I noticed that the difference is there's a spike in my sugar when I do that. Is the reason for the pill maybe coming from a different manufacturer, or they can't seem to get the 2.5 unless I go back to the old pharmacy?
Let me just say, we have about a minute left, so if you all want to try to answer that question.
I'll take half, and maybe my colleague will take half. Certainly, it probably a generic version, it should be okay and it should be good, because your pharmacist is going to have access to information when they choose their generic product. that they keep, that it should be as good as the brand name. So there may be some other reason for the spike.
I would go back if it's unusual again and see their physician. But splitting pills is something that we try to avoid if we have to. But temporarily there could be something else going on there, like Charlie said.
I got just a few seconds. What do you think about parents giving their kids adult medications?
I wouldn't recommend it, Raleigh.
Just say no.
Just say no, yeah.
Stay away from that one. Okay,
yeah,
good.
but choose generic formulations of the Tylenol now, yes.
Well, we've been talking about medications with pharmacists Dr. Betsy Ellswick and Dr. Charles Ponte. Thank you both for being with us. If you'd like more information, talk to your family doctor or pharmacist, or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Raleigh Sullivan. Good night and good health.
Join us again next week for another Doctors on Call. Our topic will be allergies and sinusitis. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.